Welcome back to Diabetic Fit Files. Today is Forgotten Infection Friday, and today I decided to cover something that is a quite devastating limb wound infections that's been going on, but is actually caused by a veterinarian sedative that's infiltrating the illicit drug supply. And as a wound care specialist, we do see some of this, and that's something called Tranq. I'm sure people have been hearing about it, but it actually causes these quite devastating wounds. And it's actually not a forgotten infection. It's actually something that is emerging right now, becoming a little bit of not possibly a crisis. So, welcome back to Diabetic Foot Files, Forgotten Infection Friday. Today, we're going to cover Tranq wounds, aka Xylazine wounds. Okay? Because I'm sure you heard the term in the news, headlines, that have real patients experiencing wounds, infections, and destructions, but we're going to discover how it exactly works. So, xylazine was first synthesized in the early 1960s by a scientist searching for a new sedative. It was investigated for human use, but they found out when they used it on humans, it caused profound hypotension, excessive sedation, and central nervous system depression. And because of these safety concerns, it was never approved to be used on humans. So it shouldn't be used on humans. So instead of that, it became widely used as a veterinarian medicine, as a sedative, an analgesic, and a muscle relaxant for horses, cattle, deer, and other large animals, okay, that are larger than humans. So around the early 2000s, and that sounds like a long time ago, xylazine became like it started appearing in Puerto Rico as an illicit drug on the drug market. And by the late 2010s and early 2020s, it spread rapidly across the United States. And then they said that they started mixing it with fentanyl. That seems like that was a problem in the headlines, and it caused prolonged sedation. And because fentanyl had a short-lived effect, it helped it make it last longer. So xylazine is not an opioid. So naloxone reverse is like we know naloxone reverses opioid component, but it cannot reverse the xylazine-induced sedation. So it has become kind of limb-threatening because these wounds do progress very rapidly and cause extensive soft tissue necrosis, abscess formation, osteomyelitis, can cause septic arthritis, as well as major amputation. So we have to be aware of what's going on right now in the world today. So let me go into it, what Tranq is. Tranq, but that's the street name of it, Tranq. Tranq, okay? Yeah, it sounds like it could be like a name of a rapper, right? Sounds like a name of a rapper, maybe, but no. So, but this is a sedative, a veterinarian sedative, okay? That is supposed to be for vets putting things to sleep, a muscle relaxant for animals like horses, okay? These big animals. This is not approved for human use. So, I don't know why people have been using it, but it causes the severe development of severe soft tissue wounds, and the wounds occur at the injection sites, away from the injection site. They said they're kind of notorious for being known to be away from the injection site. And many of these people who injected, right, they don't even know that the xylazine is present because remember they're using it to prolong the fentanyl effects because fentanyl has short-term effects. So, what does a Tranq associated wound look like? So, as healthcare providers, these wounds have skin breakdown, necrosis, aka tissue death, large areas of tissue loss, healing, slow healing, and then deep soft tissue infections, as well as secondary bacterial infections. Okay. So, why does this sedative, xylazine, cause these type of wounds? So, and remember, just this is not a diabetic foot ulcer. This is forgotten infection Friday. And this is a new emerging problem in the wound care world because these patients are taking it I'm not sure, like they said, a lot of times they do not know that they're taking it because people are lacing the fentanyl with it to make it last longer, unfortunately. And we have to have compassion for this general population too when it comes to that because drug use and addiction is an actual psychological issue. It's not just any issue like the person wants to, because once that part of the brain is activated, it's very hard, okay? But what is xylazine, okay? Like we said, it's a veterinary sedative, and it belongs to a class of drugs called alpha 2 adrenergic receptor agonists. So, like I said, veterinarians use it for sedation, muscle relaxation, analgesia, aka pain reduction, and decreased sympathetic nervous system activity. Right? Like I said, it's commonly used for horses, cattle, and large animals. Look at a horse next to a human, okay? That's all you need to know, because a human shouldn't be having this even in close in their bodies, okay? So it causes one of the biggest things that causes these wounds is that xylazine is a powerful, powerful vasoconstrictor. So like I said, it is a alpha 2 adrenergic receptor agonist, okay? And so they say it's similar to clonidine. And so when the alpha 2 receptor is stimulated, the it causes blood vessel constriction, small arteries and arterioles to narrow, and blood flow to decrease along the area. So think of squeezing a garden hose. The tissue downstream is going to receive less oxygen, fewer nutrients, and fewer immune cells. So you have to understand these injections do cause local ischemia. Now, we know that chronic ischemia leads to tissue death. So the cells we know need oxygen to make ATP, which is needed for energy and everything else. And without oxygen, fibroblasts stop producing collagen, endothelial cells stop forming new blood cells, keratinocytes cannot migrate, and immune cells become dysfunctional. And eventually cells die and dead tissue becomes what? Necrotic. And necrotic tissue cannot heal. And like I said, misery likes company. They like to eat whatever is around that is still alive, okay? Now, if somebody keeps on using Tranq and they keep injecting it repeatedly, it's going to cause repeated vasoconstriction, which is going to make it worse every single time. Every exposure of this drug to a patient or anybody may produce another episode of vasoconstriction, reduced perfusion, and reperfusion injury. And so repeated ischemia causes this cumulative damage. And this is simpler, say simpler. This is repeatedly say simpler if you're like pinching off the blood supply in the same area over and over again. So, microvascular injury. So, researchers believe that the xylazine damages the tiny blood vessels. So the endothelium, the inner lining of the blood vessels, become dysfunctional. And possible consequences of a dysfunctional endothelium is endothelial injury, microthrombi, which is small blood clots, impaired capillary flow, and chronic inflammation. So even if these large arteries are normal, the smallest vessels may fail to deliver oxygen efficiently. And what does that sound familiar? Kind of like, remember microvascular disease with diabetics, right? Now, remember, this is supposed to sedate a horse. So, sedation leads to pressure injury for these patients as well, because it causes profound sedation. And these people are not getting sedated in a nice bed or anything like that. It's a street drug. So the people end up usually on the street, and the patient can remain unconscious and immobile for hours. So if somebody's on the street and or a hard surface for a prolonged period of time because they're unconscious or sedated, right? Because they're using an illicit drug, God forbid, during this prolonged pressure causes what? The collapse of capillaries, the tissue perfusion decreases, and pressure injury develops. And they can develop these ulcer formations, especially over bony prominences. Now, like I said, the thing that they've noticed as a characteristic of these tranq wounds is that they're often not at the injection site, okay? So they've often found striking findings that the ulcers for these tranq ulcers appear by the calves, the thighs, the forearm, and the buttocks, even where these are areas where the injection did not occur. And this strongly suggests that the systemic effects of the xylazine, even though there is local needle trauma, that plays a role. It's a systemic effects. And I actually saw one of these wounds, and it was quite devastating. The tissue loss was enormous. Exposed tendon, the yellow tissue, the drainage. Wow. And it could remind you of peripheral vascular disease. Now, another thing is I'm about to sneeze. I hope I don't. Secondary infection develops, okay? That is inevitable when you have such a big type of skin breakdown and lack of perfusion. So once the skin breaks down, bacteria enters the area and the common organisms are going to be like Staph aureus or MRSA or Streptococcus pyogenes or anaerobes or gram negatives. Anaerobes love chronic wounds. Now, why are the wounds so large, these Tranq wounds? So, normal wounds, right? They heal through four overlapping phases: the hemostasis, the inflammation, the proliferative phase, my favorite phase, and the remodeling. But xylazine disrupts pretty much every phase. What do we need for the first phase? Blood, right? We need blood for everything, but hemostasis, right? Xylazine causes poor blood flow, impaired immune function, reduced collagen deposition, delayed angiogenesis, and persistent inflammation. So instead of healing, the ulcer just continues to enlarge. And many of these patients develop these black scars, a lot of undermining in the wounds, exposed tendon, exposed bone, exposed muscle. It is actually quite severe. Now, what these patients actually will need what is one of the biggest things that we need in wounds, debridement. They will need debridement often because what does necrotic tissue do? It's a barrier and it's a harbor ground for bacteria to thrive, okay? Bacteria loves dead tissue, it blocks the granulation. It prevents epithelial cells to migrate. I've never seen an epithelial cell be able to jump over dead tissue and migrate across the clothes fully, and you just have this patch of dead skin. I've never seen that before, and don't confuse the scab for that, but never seen that before in my entire life. So you have to remove the dead tissue, okay? So how are these wounds, Tranq wounds, different from a diabetic foot ulcer? So we know diabetic foot ulcers, they're driven by neuropathy, pressure, deformity, poor circulation, as well as the immune dysfunction that is going on in diabetes. So these Tranq-associated wounds, these are due to substance exposure, tissue toxicity, injection-related trauma, and vascular effects, and barriers for the patient to have consistent wound care, okay? And both require early evaluation, infection and assessment, blood flow evaluation, and proper wound care. But, what does treatment like this look like? You got to measure the wound. You have to debride it. You have to treat with management of antibiotics per your stewardship, advanced wound care. Definitely, these patients usually do need advanced wound care because of how bad the in intensity of the wound or severity of the wound happens. Now, we have to understand that patients who have substance abuse disorders face a stigma, okay? And patients do not like to be judged, and that's not our job really to judge. It's our job to care and improve. I'm getting a little tongue tied, but improve the quality care of the patient life, right? So the wound is not a reason to judge somebody. You have to remember that. It's a reason to help provide medical care, support. We can provide them with education, resources, and a pathway towards healing. The goal is not only just to close the wound. The whole point of being a wound care specialist, remember, is us to find the reason why this wound happened, what caused it, and what we could do to prevent it from coming back again. And if it's a substance abuse disorder associated wound, we have to help restore the health, function, and quality care of the patient life. So the patient needs the right referrals, okay? And what should a patient know? They should know, look for signs of redness, increased pain, fever, foul odor, black, dying tissue, drainage, increasing of wound size. And then there actually are tips for substance abuse, like injection sites, but we'll do that in another episode, okay? Because I have to cut it a little short today. But the importance is compassion. Okay, we have to be compassionate to our patients. It's not here to judge. Patients are more likely to open up to you more when they don't feel like they're getting judged, and then you'll be able to understand the wound and the whole story of the pathophysiology as well as the history of the wound better when a patient can open up and feel like this is I could tell my entire story without being judged. So let's always keep that in mind because, we want to be able to treat and increase the quality care of the patient life and hope that it doesn't become a limb threatening emergency. But it seems like these patients do present when it gets really bad, okay? But we have to refer the patients to the right people that help with substance abuse disorders, okay? We have to also remember that it's not just about the wound. It's never just about the wound, okay? So, Tranq associated wounds represent a new challenge in wound care, but it also reminds us that everyone is literally not just a hole in the skin. Everyone has a story, has an origin, circulation, inflammation, infection, environment, access to care, and the entire person behind this injury, this break in the skin is a symbol for pretty much, honestly, if you think of symbolism. But like I said, I've always loved philosophy, but wounds aren't just wounds, okay? It's a there's beyond that. You have to step back and see the bigger picture when it comes to wounds. So, you have to just not just treat the wound, but the person attached to it, okay? And I'm not saying that you need to treat somebody with a substance abuse disorder. You have to refer them to the right people so that they can get the right help to be able to tackle this substance abuse disorder. And unfortunately, it's still something that can is going on. Just like that, what's that movie not movie, TV show Euphoria. I think that does a really good job of highlighting addiction, so it plays a huge role, and I hope everybody can understand that aspect and see that it actually is a very hard thing for patients to tackle. But hopefully everybody liked this episode of Forgotten Infection, and Friday is not a forgotten infection, actually, it's actually emerging. And hopefully we can tackle this head on and help save these patients' limbs as well. And this is Diabetic Foot Files. Take care of your feet because they take care of you.